Hi everyone. In today's clip, I will talk a little bit about heartburn and gastroesophageal reflux. Just a reminder that anything I post here is not meant to diagnose or cure anything and are for informational use only. For any health-related matters, please consult your healthcare provider. Heartburn is a burning sensation and sometimes pain in the stomach, chest, or behind the breastbone. There can also be bloating, gas, nausea, shortness of breath, or regurgitation of acid in the throat and mouth. This often happens when hydrochloric acid, which is used by stomach to digest food, backs up into esophagus. Normally, the esophageal sphincter muscle pinches itself shut and doesn't let stomach acid surge upwards. But sometimes this may not be functioning properly and the acid can slip past through it, and this is then gastroesophageal reflux disease, which is called GERD for short, GERD for short. This condition can actually scar the esophagus, and if the stomach acid finds its way to the lungs, it can actually cause asthma-like symptoms. And people with hiatal hernia can experience GERD quite often. Now, there are over-the-counter medications for this, like antacids, H2 blockers, or prescription drugs like proton pump inhibitors. But needless to say that they have their own list of side effects. In severe cases, they may even offer surgery. One of the most sold over-the-counter medications are antacids. I would advise to study and research these products before sort of diving into them. Let me step back and explain the digestion a little bit. When we eat food, depending on what is being eaten, let's say if it is meat, potatoes, vegetables, fruits, etc., the stomach produces acid based on the first bite when you're hungry, meaning it will give you little acid if you start with food like, for example, salad, because vegetables, especially the raw ones, come with plenty of their own digestive enzymes. So the body doesn't need to produce much acid to sort of digest that. If you eat meat first, then the amount of acid will be higher because of the need. So now, if you have had salad first, the amount of acid produced is not enough to digest the meat that is being eaten afterwards, or something heavy, or starches that are being eaten afterwards. Hence, the foods stay in the stomach longer, and they literally go through the rotting process, and hence the heartburn and regurgitation. The order we eat food is very important in our digestion. Also, if you're thirsty, make sure to drink water 10 to 15 minutes before meal or 45 minutes after meal, and never during the meal, as that will actually dilute the stomach acid. So now that I have sort of explained a little bit about food order a bit, let's check out the issues with antacids. Antacids are a combination of different compounds with several salts of calcium, magnesium, aluminum, and as active ingredients. The antacids act by neutralizing the acid in the stomach, and they inhibit pepsin, which is a proteolytic sort of enzyme, and is there to help digest proteins. Antacids cause the body to produce more acid, which worsens the problem actually. And antacid changes the function of the nervous system. Antacids contribute to both lower, like more acidic pH, and a higher pH or alkaline, which will have an inhibitory effect on the motor activity of the spinal cord. Taking antacids interferes with iron absorption, leading to microcytic anemia, right? Antacids also inhibit phosphate absorption from the intestines, so they deplete the bone mineral, and it results in osteopenia, which is weakened bones, increased risk of osteoporosis. Hypercalcemia, for example, which is too much calcium in your blood, also can be caused by that. This is because calcium, to be absorbed, requires the acid in the stomach, and when we dilute the stomach acid, calcium is not properly absorbed and deposits in the wrong areas, including kidney stones, which actually reminds me of a TV ad regarding a certain antacid that has added calcium. And that pretty much becomes comical, actually. So antacids that contain calcium or aluminum may cause constipation, and if they have too much magnesium, they might cause diarrhea. And these are only few things that I can think of right now that actually they can cause. On the alternative solution area, taking digestive enzymes, bromelain, B6, B12, and even just apple cider vinegar, which is only 1 tablespoon in a small glass of water, are proved to be helpful. If the burning sensation is so bad that you cannot stand it, usually drinking a teaspoonful of baking soda in water calms it down. But this also should not be a regular practice. Even safer, actually, is taking a few romaine lettuce leaves and chewing them many times before swallowing, or for soothing your tummy, and also a bit of aloe vera may help. You can peel the piece of aloe vera, chew and swallow the gel inside, basically. Not the aloe vera juices that you see, but the actual aloe vera. It's a bit bitter, but it is quite good, and it's good for your liver as well. Also, juicing raw potato and mixing the juice with equal amount of water and drinking it immediately a couple of times a day is a good option. Different things work for different people, obviously. So some suggestions would be avoiding foods that can trigger GERD, like coffee, alcohol, acidic drinks. Avoid large meals. Quit smoking if you're smoking. Elevate your head when you sleep. Not lying down immediately after you have eaten. Avoid vigorous exercise after eating. Don't eat a few hours before going to bed. If you're overweight, obviously shedding some pounds will be helpful. Avoid stress and anger. If the heartburn is due to a medication you're on, maybe you want to sort of talk to your doctor as well regarding that. Pregnant ladies, as well as those on birth control pills, can have high levels of estrogen, which will also contribute to heartburn. On the spiritual and emotional side of things, eating is not just about absorbing nutrition for our physical body. It is also swallowing and assimilating our experiences. Digestion is about absorbing everything that is happening to us, along with our feelings, and also eliminating anything we don't want. Our digestive system can be a good mirror of our emotional state. When we feel safe and happy, our digestion tends to be reasonably maintenance-free. If we are experiencing conflicts, stress, or emotional turmoil, then often this shows up as indigestion. This is why during eating times it is best to skip listening to news on TV. Acid reflux is also a sign of experiencing difficulties in regards to digesting life in general. Our body is letting us know that we are feeling uncomfortable with what we are seeing, feeling, hearing and experiencing. We might feel irritated, frustrated, and out of control. We are sort of resisting life in some way. Again, please consult your healthcare provider if you're experiencing any health issues. Hope this information has been of some sort of help. Like and follow for more. Be the light.